Right. Bismillahirrahmanirrahim. Assalamualaikum and a very good afternoon to everybody who is here. Okay. Okay. We're going to do some introduction to safety and health. Okay. What I will be talking about. Okay. In the next few weeks. Okay. So first is Malaysian. Southeast Asia, Malaysian in Southeast Asia seems to be the fattest. And being fat or obese is what we call as non-communicable disease. Yeah. Search what is non-communicable. If you like to search, what do you mean by non-communicable disease? What do you understand by non-communicable disease? Hello, I'm asking,
Yes, ma'am.
what do you understand by non-communicable disease?
Caused by unhealthy behavior, ma'am. Prof, sorry.
No, what do you mean by non-communicable disease? How do we define non-communicable disease?
Something that's not caused by virus or
Yes, Sagut. Okay, Azad, that is the meaning of non-communicable disease. Things that are not infected by bacteria, but it is caused by, for instance, being fat, obese is through your lifestyle. Okay. So this is the percentages of Asian as what we mean by fat. Okay. These are the non-communicable disease that is affecting Southeast Asian people. Okay. So overweight is leading, okay, the problem. Then you have hypercholesterolemia, okay, that we regard to how high is your cholesterol in your blood, which requires you to take a lot of medication, okay. Good question. Does overweight relate to being hypercholesterolemia? Yes. Do you think that people who have high cholesterol are necessarily big? What do you think?
no.
Do you have friends around you that is high in cholesterol, having a problem with their cholesterol, but super thin?
Yep. Yes.
I have two actually. I just found another one yesterday. So um, really surprised me. And one of them is very young. Even the second one is a bit younger than I am. I think about 1 year or 2 years younger than I am. And the other one was much younger, 10 years. And both of them has been on medication for some time. So that surprises me. And then you have hypertension, okay? This is with regard to your heart, and then diabetes, okay? So I thought diabetes is, you know, the worst scenario that we're facing, but not really. We overweight or obesity is actually our biggest problem. Okay. In Malaysia itself, only 1/3 of the adult population had ever exercised. Okay. And 14% perform adequate levels of exercise. Now, even though we go to the 14%, it's still, even a small portion, very small portion of people, out of 100, only 14 people actually adequate level, not the required exercise, but adequate level of exercise. So this is very worrying, okay? But I'm told, okay, when we talk about obesity, we talk about diabetes, and we talk about exercise, I have been educated by the people in the sciences that when it comes to weight, 60% is due to food. Only 40% is influenced by active activity. Yeah. So at the end of the day, we have to watch out our food intake. So let's see whether you can also hear this. If you cannot hear the audio, please let me know. Can you hear the audio?
All over the driving range and hit a few virtual
Very
balls.
clear.
Yeah, we did that yesterday.
All right. So let's start again. So this is uh, s- it's actually a clip of a story. What was the story? Cannot remember now. It may come back to me, but it's a clips of the story where a human are not anymore living on Earth. So for some reason, Earth has been polluted, and the air has been polluted so much that um, we were transported to live in not in another planet, but in a ship, a very big ship that housed the whole population of the Earth. But that was not the main of the story. The story is in that ship, our activity lifestyle has been reduced. And because of technology, driven by technology, we have changed the way we things work. So this is what happened when our life is dominated by technology, and the way we um, move around has changed. So let's have a go at this movie, and then we'll discuss.
Let's all over the driving range and hit a few virtual balls into space.
Yeah, we did that yesterday. I don't want to do that.
Well, then what do you want to do?
I don't know. Nonsense.
Make a place. I'm not jealous because it does sound.
Look, I'm tired of it.
It's making all your stuff. If you can't feel the straw, you have these gotten any good.
Over here.
Tunnel, tunnel. I'm in the tunnel. I can't hear you.
By and large, everything you need to be happy. Your day is very important to us.
Hey, drink the pot. Here, take the cup. Hey, take the cup. Oh.
Please remain stationary. A service bot will be here to assist you momentarily.
Stewards. No.
Please remain.
Somos and
So did everyone manage to catch with the video stop? Why didn't you why didn't you unmute and let me know? Was the video stop?
Yes, Prof.
Oh, why nobody actually mentioned to me? I was watching the video. At what point did it stop? I mean, now it is stopped.
Now is still stop, Prof.
No, it is stopped now. But
Yes.
at what point did it stop for you?
When the fat guy fall down.
Oh, okay. So that's very far away.
Yeah.
Okay. So you should actually unmute. So this was the point where it stopped, right?
Yeah, almost, yeah.
Okay. So that's very far. Okay, let's.
By and large, everything you need to be happy. Your day is very important to us.
Hey, drink fast. Hey, take the cup. Hey, take the cup. Oh,
Please remain stationary. A service bot will be here to assist you momentarily.
Stewards. So,
Please remain stationary. A service bot will be here to assist you momentarily.
sir, what's going on? John. No. John. Hi, Chloe.
A is for Axiom, your home sweet home. B is for by and large, your very best friend.
Time for lunch. In a cup. Feels beautiful. It's the new year starting. I know, honey. Attention, Axiom shoppers. Try blue. It's the new rain. Don't get me started on the day. Every day I have been on that been hot. Sorry. I know because I spoke and I said, what? Huh? Mary? Huh? Oh, sure. Okay.
Hey.
I didn't know we had a pool.
Okay. Is that okay? So now it stopped. Okay. All right. Okay. So what you just watch, what you have just seen, what did you observe? Anything? Just
They are just sitting all the time.
okay. All right. What else?
No physical activities.
Okay. So what happened? What do you think is the impact of no physical activity? What can you see out because of no physical activity? What are the things that you think is the impact of very little physical activity?
They are getting bigger and bigger.
Okay. Are they, of the same size?
Almost.
Okay, almost. What else? Almost. What else? What else?
They even cannot, get up by themselves after fall down. They need help.
Okay. What else? I will come back to that. That's very important to understand. Yeah. What else? Come on, there's a
Didn't wear
lot of
seat
things
belt, so
that
they
we
fall.
see. Again?
They didn't wear seat belt, so they fall.
Okay. No seat belt. What else? Come on, there's a lot of things you should see.
Professor, it's not a natural beach, it's man-made.
Okay, good. That man-made. What else? What else?
Hello, Professor.
Mm-hmm.
From my opinion, maybe it's be danger.
Danger? Dangerous.
Yeah.
Okay, good.
I see, Professor, sorry, I see a digitalized tree, not the natural tree. The natural tree comes out oxygen, but this one I see it's digitalized.
Yeah,
I
okay.
see digitalized tree.
Okay. So everything was made what?
Digitalized, I mean.
Digitalized. What else? It's meant to be? What's the word?
Technology.
All not natural
Technology.
things.
Non-natural. So how would it impact? It should be what? What is meant to be when it's digitalized, it's, man-made.
Cancer, it's like
Automated.
it leads to the illness, sick, and something like that.
Okay.
They will
It's
not be
just,
safe. They will not be safe.
yeah, all the same. So when it's all the same, what what becomes of it? How would it impact? What is it supposed to?
Everything is automated.
Yeah, and it's supposed to be simple, right? Simple to manage, less maintenance. Everything is supposed to be very efficient and effective, right? Same size of person, easy to meet to measure clothes. Everybody can fit into the same, size. Okay, and the trees, they're not meant to be difficult. So if is digitalized, you don't need to water it. When you don't like, you want a different design of tree, you can always design a different one, and in a split second things change, just like just now. Yeah, food are being delivered, so less activity. Now come back to Bashira, when you said the guy fell off and then he couldn't actually pull himself up. So please, people, why do you think that happened?
Because
Seat
they were
for
depending
very
on
long
the machine.
time.
Again, I can't. It's not very clear to me.
Maybe because seat
Because
for
they
very
were
long
depending.
time.
Okay,
The
Bashira
function.
first, and then Sagu.
So maybe in my thoughts is maybe sit for quite some time and then the leg cramp or dysfunction.
Okay, so that's what you understand, yeah? Sagun, how do
They
I
were,
address you properly, yeah, Saguntala? Devi
yes, you
or
can call me
Sagun?
Sagun, Prof.
Okay, all right. Thank you. Sagun, what is it?
They they were depending on the machine all their life and they don't know how to walk.
Okay, could possibly be. Okay. Anybody else who wanted to give an input? Who
He
we
never,
know?
he never try practice a walk.
So therefore he can't walk.
Yes, because possible all instant with supporting with technology.
Okay. So, yeah, I mean, I never thought of that, that they never learn how to walk. Therefore, they do not know how to walk. Exactly. Yes, that can be one of the factor. You do not know how to do the things. Yeah. So therefore, you can't do it. Exactly. Yeah? But let me tell you another physiological problem that could occur when an do you know when an astronaut came back after their tenure to the moon or to the aerospace. Are you aware that they are not allowed to immediately, um, leave the compound of the NASA? Are you aware that they had to be quarantined for a month or two? Are you aware?
Yes, saw in the documentary.
Yes, ma'am.
Okay, good. And do you know why? Do you know why astronauts are not allowed to leave the facility immediately after they landed on Earth?
Not sure, but because they were too long in the space and they must suit their body to the Earth temperature or something. I think so.
Correct? Anybody else? This is a good discussion. Thank you. Nothing is wrong. Everything is correct. Anyone else? No. Okay, don't let me just be the one who eventually, if I'm the only one who giving input, then I will ask you to do research. So anyway, what happened is when you don't use your bones, the density of the bones will be reduced. Okay, they will be on space, in space for months, and therefore they would actually the bone density will be reduced. Your sum tulang, the things inside your bone, that's the calcium and so on that's supposed to strengthen the bone structure is not there. It's like a empty hole of the bone. So the moment they step out of the knee using their leg, it will brittle down. It will be broken and brittle down easily. Yeah. So because that's what happened when you don't make use of your bone and body structure. So if you don't speak for a very long time, eventually you will lose the use of your muscle, cheek muscle. And if you use it a lot, the brain will be notified to wire or to transfer more calcium into that part of your body. Okay, so working more is not bad for you actually. The more you use your body for things, the more you think, the more you grab things, the more you walk. Okay, your body is supposed to be stronger. Okay, the brain will signal to the brain is okay. Can you give me 1 second? Give me 5 minutes. I need to run down and get something. Yeah.
Okay.
Sorry. What I ordered food for iftar. Then the first order missed my drink, so I had to reorder late, and that's the reason. And they don't want to bring it up to my room. Okay, so let's continue. All right. Okay. So it is recording. Okay. All right. So as I'm saying, yeah. So that's what happened to your body. The reason why the astronauts are not allowed to leave the compound, because it will actually damage the bone. Okay, so they will need to go through physiotherapy to strengthen the bone again, and to learn, as you mentioned, to learn again how to walk, not to go fast. If not, the bone actually will just brittle down, and there will be a disaster for each one of them. And they have to actually make sure the bone density has improved, and then only. So the same goes here. Yeah? Maybe it has been too long that they have been sitting on that chair and being, as you can see, even the food are being transported to them. Instead, them going to the food. So there's a lot of needs for movement. Yeah? And if you see the neck, this is the neck are all big and large. Yeah, there's no neck. Okay, because this part of your head, yeah, is formed by muscles. Yeah, so if you exercise less, yeah, your neck will go bigger in terms of size. So that's what happened to all these people here. Yeah? Less movement, less activity, and therefore, like the guy who actually fell down, he can't pull himself because his bone structure down, lower abdomen, yeah, is not functioning. Is not able to actually help him to pull himself out or to sustain the weight of his upper body. But the hand that is used to click that, do that, and then communicate and so on is move. Okay, and that's the reason. Even the tummy looks big. So when your lifestyle change, your body structure will also change accordingly. And what do you think? Are we almost, going into this mode? How long have you been sitting today? How long have you been sitting today? How much standing up have you done? Okay, the whole day. If like myself, I'm sitting in my office, I can be just sitting down until 9, at night, without having to move, especially during Ramadan. Yeah, you don't want to actually walk around. Yeah? You tend to actually just sit down, and take a very passive, passive you rest mode, because you are quite it's a challenging time. On top that it is very hot. Okay, so this is the changes that will happen to our life. Now, why does it matter to us? Okay, so even though you're a human resource person, you're a manager, you need to be aware of this. I think that you need to be aware of this because you'll be facing and you're managing and you'll be working with other people. And other people, or you will be managing others. So you need to think about the changes and the things that is happening at work, okay? Because it actually would have an impact on the health and the well-being and the condition of the human being. If you do too much activity under the hot sun, what will be the consequences? Okay, there are always consequences to any decision that you do. But why does it matter to know? Doesn't this is handled by the doctors, the medical team? Correct. When they are sick, because that's the only time that we go to the medical. Just like one of my experience in recently when I was in the industry. So I work with recently I went for a sabbatical in industry, and I was with the in that company we have the safety riding team. So I was serving in that safety riding team. So the safety riding team specifically train is meant to train in-house the people of safe riding, okay, specifically. And then they also monitor the traffic accident, and also doing traffic accident assessment. So any of the employee had an accident, so the team will go and investigate, okay, and interview the victims, and then find out the root cause of the accident. So during that time, there was one fatality. During my time, suddenly we received a news that one of our colleague from work ran into the back of a truck. So there were a lot of colleagues around him when that happened, and everybody cited the same story, where he was just going fast and he just rammed himself into the back of the small lorry without any reason. It was not many car. It was a very straight head-on hitting the back of the truck, and that collision was fatal because he hit his head first, and it was very fast. Okay, so because of the fatality, we decided we went through and investigate, and they had to also ask colleagues, and that's one way of how we investigate during the pandemic, especially. So you ask friends and observer witnesses what happened. We don't ask them what. So one of the things that they say is after interviewing the friends and friends who work with him, it seems that he has vision problem. Okay, and that night was the only, one of the night that he had to ride a motorbike. He has a car. He usually come to work by car, but that day his car was serviced. He had to go for a service, and he took the motorbike to come to work. Okay, that was the first week. I do not know what day, how many days have he been riding, and that was the first month where he had to work at night. Okay, so there was never he was never having to work at night shift. But that night he had to work at night. There were like they changed his work shift, okay, to night time. Before this, there was no night shift. There's always one shift. So then we went to the family and we investigate, and it seems that he has a vision problem, but he refused to wear spectacles. Okay, from that evidence, we concluded that that is one of the another confirming story. He is already planning to leave the this factory where he works for almost 18-20 years. Okay, when the moment they change his shift into night shift, that means there's a possibility for him, there's a requirement for him to work night shift, he decided to leave the company. So we make a conclusion without finger pointing to anybody that it is possible that he has a vision problem, and that is one of the reasons why he did not want to work night shift. And that particular night, most probably he didn't see the truck. The truck was in white. Okay, so he rammed into the back of the truck. most probably he didn't even see the truck. He was going fast, and by the time he wanted to, because there were other colleagues who are at the back of him that didn't see him braking at all. They remembered that. They were actually surprised when he actually goes straight and ram into the back of the truck. They were all traveling at the side of the left lane. Okay, so we concluded because of the vision problem that leads to death fatalities. Now, this is where we need to understand, okay, the limitation of our colleagues. You mentioned to me, Sagun, that you had a friend with high cholesterol. You knew you have somebody near you with high cholesterol. I'm assuming it's your friend, is it?
Yes, Prof. My colleague, previous colleague.
Ah, okay. So, knowing things like that, okay, not to excuse the person from delivering what he or she intends to deliver, but with guided and monitored, okay, not to give excuses to people not to perform, because if they have accepted the position, that means they have to perform according to what is expected by the job when they accept the job. However, this will understanding people's um, limitation and boundary, helps you to accommodate and to provide space and means for the people to perform. All right. This leads to also issue of OKU. We're not saying that the disabled people cannot contribute. They can contribute as maybe effective as we are, that can walk and run and talk and are healthy, but they perform differently. They need assistance to help them to perform. All right. So understanding the boundary and the limitation is important to make sure that everybody are able to perform their tasks. Okay, definitely people with disability wouldn't be able to, most probably, I do not know, cannot easily carry heavy things. Yeah, but I assume when they accept the job in that condition, we know that they can't do that job, but they can do other job more effectively. Okay, things like administration, paperwork, computer related job. They should be able to do that excellently. All right. So these are some of the consequences of um, obesity, the consequences of health-related matters. Okay, so it will consume a lot of healthcare spending. The more people of obese that you have, that means you may have a lot of um, MC days, okay, or treatment, okay, to go. And obesity will eventually lead to diabetes. There's high risk for diabetes and cholesterol, okay. People without obesity can also get cholesterol, high cholesterol. But people with obesity is highly likely, okay, to be high in cholesterol problem, hypertension, um, less ability to walk, and therefore you will actually have a lot of knee pain, pain to the lower body abdomen. Yeah. Um, yeah. So from this analysis, it was revealed that then 20% of Malaysian aged between 30 and 70, 30, okay, not 50, but 30. Okay, how old are you? How old are all of you? So people within this age have a chance of dying from the non-communicable disease, cardiovascular disease, diabetes, cancer, and chronic respiratory disease, the inability to breathe properly. And how does it affect So healthcare spending, it's consuming 10% of our spending is due to managing obesity. The GDP is costing GDP by 0.39%. Okay. And productive year loss. It was calculated as well. Productivity years loss for Malaysian is 6 years. Yeah, Filipino has more. Okay. Okay. 6 years. All right. Out of 11, okay, it will actually lost 6 years. You're only good for 5 years out of 11. Okay. So that is, I don't know. I don't know whether it's attractive or not. Okay. Now, what are the consequences of obesity to, I've mentioned, lots of leave days, probably, higher spending, yeah. And then if you're sick, or, when you have hypertension, when you have hypercholesterol, you may have a lot of headache, or um, tiredness, easily tired, okay, and therefore your performance at work may be affected. Okay, so this is what we at work do not want. We do not want people that cannot perform aggressively and actively at work. Okay, so why is it an employer's concern? Why do we employers need to be sensitive to this? Isn't this a personal problem? Can't you actually manage it yourself? If you have hypercholesterol, shouldn't you actually eat your knee and then, manage your health? Okay, why should it be an employer concern? So Tan Sri Lamtai, an activist in Malaysia, then a chairman of the National Institute of Occupational Safety and Health, one time ago, mentioned that it is supposed to be an employer's concern because working adults, spend about a third or more of their time during weekdays at work. For one day, a third or more of their time is spent at work, just like us today. I've been here from 9 a.m. I'm still here until 9 p.m. Okay. And maybe today, when I return to work, I immediately will just go to sleep, take a rest. Okay. But other days that I return at 7 or 6, I may continue do my work until 11, until 12. Okay. Take a break for dinner. And then I will continue and do my work. So it should be an employer's concern because for Malaysian, working adult, a third or more of their time during weekdays are for work. So because of that, it should be an employer's concern. Now let's look at, this is an old, I should have put the latest one, okay? So sorry, but let's look at this for today. Now, this is a Perkeso statistic, okay? Perkeso statistic on compensation to employment injury, all right? Okay, so employment injury, yeah? And if you look at this, I want you to focus on the yellow part here, okay? This spells out compensation to employment injury that is compensated by the Social Security Organization in Malaysia. All right, for instance. So what is dependent benefit? What is permanent disablement benefit? And what is temporary disablement benefit? Let's choose. Okay, I'll give an assignment. Azhar and Briar, you Google on what can dependent benefit means. Yi Zuan, Lin Hao, you Google what can be temporary disablement benefit means. Bashirah and Sagun, you Google permanent disablement benefit and see what you can find and post it in the chat box for us to review. Do you follow me? Are we all okay?
Yes, bro.
Thank you. Very good.
Okay, Professor.
Okay. Okay, I'll give you 2-3 minutes and then we'll check the chat. Yizhuan, it's temporary disablement benefit, dear. Okay, let's look at this. First, permanent disablement benefit. Bashira and Sagun, can you just sum up what you have written? Okay, hold on. No. Okay, everybody reads what everybody has written. Now, Lin Hao, I want you to explain to us what do you understand by what Bashirah and Sagun has provided in the chat. Lin Hao? Lin Hao? Or Yizhuan? Either or. Can you summarize?
Hello, doctor.
Hi. So how can you summarize what permanent disablement benefit is that has been written by Bashirah and Sagun? Can you explain to us? What do you understand?
It's kind of uh if some people get injured, maybe government, maybe company pay their salary.
Okay, that is what you understand.
I understand. It's a temporary disablement benefit. Mean.
Okay, so would this benefit be for people who cannot come to work or can come to work?
Cannot come to work.
Okay, so that's a permanent disablement benefit. Okay, the benefit, reward or money that is given by, in this case, the Social Security Agency, like an insurance company, yeah, but it is managed by the government, for the benefit of the people. So given by the Social Security Agency to workers who have been injured, and the probability of returning to work very minimal or none at all. Okay, that is what we refer to as permanent disablement benefit. Sagun and Bashira, how about temporary disablement benefit? What do you understand from what Lin Hao and Rizwan put down?
It's a temporary payment for those who got injured in their workplace and they can't work for certain time period.
Yeah, for a period of time, yeah. But their injury is not severe, and doctor thinks that they will be able to actually come back, return to work, after recovery period, after undergoing treatment. Okay, good. And dependent benefit, Briar,
Yes, Professor.
what do you understand by dependent, Briar and Azhar? I don't see Azhar here.
Okay, Professor, as far as I can see, it's financially compensations provided by the organization. And based on this chart, that figure that you provided, this dependent benefits compared to 2010 until 2018 is skyrocketed, which means the risk of industries are skyrocketed. And it's not permanent. It's defined. I mean, it's a defined period. When the workers got injured because of their organization's work, something like that, they'll compensate for them. And they say that it depends on the insurance program or in the the country. There are some countries that they rely on state and federal government. Sometimes they will cover that expense, and sometimes the insurance company or the organization will cover the expense, the salary, I mean.
Okay. No, actually, when we talk about benefit, it's not salary. Salary will continue be paid. Benefit is on top of salary. Okay.
Yes,
So
yes.
they may receive salary, but they are receiving additional assistance. Yeah. Benefit here is the additional
They
assistance.
can't work anymore. I mean, temporary, something like that.
Dependent benefit is, as you have spelled it out there correctly, that family members is receiving some assistance in terms of monetary assistance when their family members who is working, who is the worker, is either injured or die. If they die, then it'll be sometimes a pension for a period for a long time. It's called pension to the dependent. But if the worker did not die but needs recovery assistance and requires the they may be entitled to carer benefit. Okay, so I think this is in existence in other countries as well, but this is something that that is available in Malaysia, provided by the Social Security Agency called SOCSO or PERKESO. Malaysian who is working should be very well versed with this concept of PERKESO and Social Security. So maybe Azhar is, but Azhar is in Malaysia, right?
Professor, sorry, just I want to ask. Yes.
Yes, continue.
Okay, sorry, I heard a strange noise. In my country, I haven't heard about the agencies will cover this. One of my friend, he was a butcher. Okay, he worked in one of the hypermarkets, well-known hypermarkets. It's like Walmart in my country. So he cut his hand by the knife. So the organization still now they provided that benefit to him. It's been around 5 years still now because he cut his hand by the sharp machine because he was because of butchering.
Yeah. So it's not really the company that is paying, but the insurance company or the the social security that is there presence. Yeah. So what I wanted to as have been concluded by Briar just now, yeah, nicely, that there is actually, if you look at the meaning, that this yellow share here is getting bigger and bigger, 3 times, or double the amount that is paid to other type of benefit, isn't it? So meaning that the injury or the incident that leads to permanent disabled benefit is getting bigger and bigger. Yeah, at least for Malaysia. All right, I can only access data from Malaysia, so I'm presenting it to you. So it's getting bigger and bigger. So meaning that there's a lot of things that is at work in Malaysia that is very dangerous, that can cause permanent disablement, that can cause people not to be able to work after the incident. So for Malaysian, you should be terribly worried of the pattern and the development. Okay. In other words, we can say that the work in Malaysia are not very safe. Are not safe, not very. Okay, I have data from 2020 for 2022, 23 and 21. But it's almost the same now. 2019 to 2020, because 2020 is the pandemic time, you see a downward trend. Yeah. So the yellow line here represent the number of accident in for workers, involving workers traveling to work and coming back from work. Okay, so you can see there is actually an increase in the number of workers here. Unlike industrial accident, it seems like it's going downtrend. But actually, I think it is also going upward trend for industrial accident for recent cases. All right, I shall build the line chart so it becomes much more clearer to us. I have data for 2021, 22, 23. Let's plot it and see whether it is getting higher and higher for even industrial accident. So in Malaysia, commuting accident on the road for workers is also compensated. And this is why the Social Security Agency keep track of the number of accidents involving workers on the road. Okay, so it's going upwards. So meaning there's a lot of compensation that will be paid out with regard to this problem. Okay, so how does work on the road is also a concern for Malaysian, because people do not arrive to work. Okay, workers need to arrive at work to work. But if they fail to arrive at work, would there be any work? No. Okay, and a loss of investment. A loss of investment to companies. Okay, and this is the reason why this is becoming a case study, okay, for Malaysia. All right, and most of these accidents involving workers on the road are when they are coming to work. This is very consistent. I study road safety incident among workers in Penang. And this is the national data. National data says that commuting accident involving workers, okay, happen mostly on the way to work in the morning. So that is similar to what we are seeing in Penang. Penang data also shows that most of the accident involving workers on the road traveling to work in the morning. Okay, so consistent. All right. So this is also a concern. Now, this is a graph representing industrial accident cases until 2020, data that I have across state. Across state. So we are in Penang, Pulau Pinang. Okay, so these are the states in Malaysia. So if you can see here, there is actually an increase in the number of industrial accident. Now, industrial accident refer to, okay, accidents happening at the work, at workplaces, involving machinery, involving the need to move in the workplace. So if the accident involving secretaries, okay, my question to you. A secretary cut off her finger while trying to operate a paper cutter. All right, lost her finger, the tip of her finger. Is that considered industrial accident? Question. Is that considered an industrial accident?
Yes, Professor.
Yes. Yes, it is an industrial accident because the nature of the workplace for the secretary is the office. Okay, so she's doing her one whole administration mandatory job, cutting paper using a paper cutter. That's normal for admin person. So that is considered industrial accident. Okay, so the four states here is the states near to Penang. Okay, Penang, okay, Perlis is up north, Perak is down south of Penang, and then Kedah is upper north of Penang. Okay, this is occupational disease. Now we talk about just now about non-communicable disease, but occupational disease is communicable disease. Okay, disease that is infected via certain chemicals. Okay, so this is the cases in Malaysia again with regard to occupational disease. So you can see from the graph that most Perlis, a state up north, the northern part of a state, the northmost, the top north in Malaysia is called Perlis. So it seems that Perlis has a high number of records with regard to occupational disease. Now, let me illustrate from my own research injuries and the cost to companies as an ending to our first part of our class. Okay. Now the blue line, okay, I take two most injured body parts for a motorcycle riders, which is the hand part and also the leg and knee, 26% and 42%. The topmost body parts injured for motorcycle riders when they have an accident is the hand part and also the leg and knee. Now, we calculate the cost incurred by the company involving only two parts of a motorcycle rider's body, which is the hand and the leg. And from here, so this is the salary of a worker. Spare man means when the worker failed to arrive at work because of accident, automatically a company will take on a replacement worker. That's called spare man, a replacement worker. Okay. So this replacement worker, okay, will have its own salary. But when the current worker cannot perform, that means you are calling this replacement worker to come to work and maybe to support a lot more, because usually replacement worker is only 10% of the total headcount. Okay, so if you have like 60% having an accident, you need to rotate the 10%, okay, over time. And this is actually the cost incurred by, because you still have to commit the salary of the injured worker. So that means the cost to the company is the red line, double. Okay, doubling the salary that needs to be paid for the injured worker, a spare man. So if you can reduce the number of accident involving workers, injury involving workers, you will not have to have the replacement worker at all. Okay, you can have people coming to work to replace injury people. When you don't have to have extra replacement worker are extra workers, okay, in a workforce. So it means that in terms of economic loss, company are losing, okay, money because they have to commit and they have to they have to create, okay, a specific job to cover possibility injured workers. Okay, and on top of that, companies are paying the salary, but there's no productivity counted for the injured workers, isn't it? They don't actually come to work. They don't, and do you know that replacement worker are usually a more specialized or higher level workers. So therefore, their pay is much higher than the worker that is injured, usually. Because replacement worker needs to be able to work at any, at any point of the work process. Therefore, they are very experienced workers. So their pay is higher, 4 times higher, 3 times higher. And if you lose a lower level worker and you take on a spare worker, that means you're wasting your money in terms of salary, but the trained worker is not performing. So you lose 50,000 like this one, you lose 15,000. Yeah. And then you lose how many thousand? Okay, here. All right. Okay, two injuries to the body parts that highly among assembly workers. I hope you know what is assembly workers. Those who actually need to use their hand to use all the tools that is involved in the work process. So it seems that the assembly workers' injury to the hand and wrist is high. So that means quite a lot of these people wouldn't be able to actually function effectively at work. Okay, even though sometimes they are injured, they still turn up for work. But in reality, even a scratch to the hand would not allow them to hold the tools safely, and they will be required to just sit at the side, take a rest while his work is taken over by other people. All right, so this is no good for workplaces and productivity. Okay, when the injury involves hand parts, so it's not good. All right. I think we'll stop there because this is going to be a long discussion. Okay. And think about what we just covered. Okay, I will have a question following this. So, all right, have a good iftar for those who actually are breaking fast. Okay, I'm breaking fast on my side now. So, let's convene by 8 today. Thank you. Okay. Right. So far, okay. Bismillahirrahmanirrahim. Assalamualaikum. And let's continue. So far, I've discussed about different kind of health-related matters, and like obesity, immobility, inactive lifestyle that can cause many that can immobilize your ability to be active, and it will lead to a number of health problems. Yeah, and I try to present, okay, the impact of work-related injuries, okay, the status of work-related injuries in Malaysia, okay, specifically. And I think it is similar in other countries. So I have gathered a few recordings that talks about safety and health status at their countries. So I'm trying to get more. I've found a few that make comparison between one country to another. So I hope to get more in English, and I'm sharing it with you to show that the problem, the number may differ, okay, but the problem is the same. okay, the problem of um, safety and health at workplaces. Okay, now why did I presented all these uh, scenarios, cases? Because I think these cases are not common, okay, commonly discussed. But if you are a worker in Malaysia or in other countries, actually, I've been discussing this with, like this one. This is from a study in America, in Chicago, specifically from a colleague that looks at productivity and issues at workplaces and its relationship to parenting responsibility and family well-being and so on. So work-related matters have always been um, accepted to always have to always will be spilling over to your non-work uh, uh, environment. Yeah, and one of it is involving workers that have to work shift hours. Who have to work shift hours? Can you name a number of occupation that you know would have non standard time that have to work shift, rotation kind of scheduling? Can you name a number?
Security guard.
Very, very good. Who else?
Manufacturing operators.
Correct. Well done. Come on, there are many. Who else?
Nurse.
Exactly. Very critical position, isn't it? Doctors, yeah. These are, I mean, if you name operators, security guard, yeah, we can argue, or they're not that important. If that they are not important, how come manufacturing built double shift, triple shift, to operate? Because they need to respond to demand. When there demand, that means there more work to be done, and that's why I don't believe that operators are not important. Okay, they may be more critical, and I've seen this during the pandemic, where the intention to be more stringent on COVID monitoring is simply because you don't want um, people to be infected by COVID, because they need to work, they need to be able to come to work. Yeah, so everybody is critical. As long as they have a working position in the workplaces, they are critical. All right. So this is a study from Chicago, a colleague of mine that study shift work or non-rotating work scheduling and its impact to many aspects. But I want to take just this one statistic, how it impacted the upbringing of their children. So there's an increased level of US American children sad and mad behavior associated with exposure to parents level as schedule instability. This I do not know about operators. I've never asked them specifically, but I know for sure, like nurses, doctors, they have schedule instability. Like schedule instability means sometimes their working hours has been specified. However, there are probability that it will be changed even though it has been locked. Okay, because of sometimes emergency cases, sometimes colleagues cannot turn up for work when they should have. So it requires changes to some of their work scheduling, and that leads to instability. That's how we define instability. Now, if you have one form of schedule instability, okay, that the left side, this side is actually the level of sadness and madness feeling, emotion expressed by the children. So as you go, okay, as you go towards the right, the working schedule becomes more unstable, and the higher your instability, that means the children are much more unhappy. Okay, unhappy. So when children are unhappy, that means their upbringing will be affected. Yeah, their psychological, there will be psychological consequences. Okay, and behavior deviant behavior will actually erupted from the children. So this, how would this affect us? How do this kind of statistic and study matters? To whom it would matters? It may not matters to managers in a manufacturing firm. To which part of the country's upbringing or development would this kind of results be of interest? What do you think?
Professor, can you repeat the question? Would you mind? Sorry.
No, I don't mind. It's okay. This is the statistic. This is the result of findings, right? Study findings.
Okay.
My question to you is, to whom would this kind of results be of interest to? Who will be interested with this kind of result? Who will be interested with this kind of findings? Obviously, managers in the manufacturing firm may not be interested with this kind of findings.
Yes.
Because it doesn't impact them that much. But who would be interested? Who would be affected?
Probably the country may have rising cases of social problems.
So who will be interested?
This research is in favor of employees, not the employers.
This is in favor of the employees, but who would be interested? Because if you're talking,
the future management, the next generation's company.
Exactly. If this is the situation, right? If this result is true, right? It's true even in Malaysia, the country leadership should be very concerned, because children will become adults and they are the future generation that will become leaders for the country. Disobedient, tantrum, aggressive behavior would lead to what? Social ills, in the society. And what become of our leaders, right?
Exactly. If they are not psychologically stable, they can make the country stable.
So this is my point. This is what I wanted to raise. So safety in health practices. So how we came to this? Because of work schedule instability, right? It comes from the workplace, but the impact is multifold and covers all spectrum of our life. So workplaces play a big role in the country's well-being and country development. This is what I'm getting at. I hope you understand. This is work-life balance survey in 2018. This is the only thing that I get. Okay. And during pandemic, so we talk about a lot about working from home. People wanted to work from home. So let's see the two questions. Okay. The left-hand side, okay, the blue one represent graphs of male academics. Then the red one is the female academics. Then the green one represent professional staff. Okay, there can be non-academic, but professional, engineers, nurses, doctors. So the first question on graph 4 says, to what extent do you feel that your work has a negative effect on your mental health? Okay, nowadays at workplaces, post-pandemic, there's a high rise of discussion on mental health. Yeah, so the scale went from not at all to a lot. So from left to right, okay, you kind of saying that it has a negative effect on my mental well-being a lot. Okay, I felt that it is having the work is having a negative effect on your mental health. Now from left to right, it keeps on aggressively increasing. A little is higher than a lot. But professionals claim that the scale of its negative effect on their mental health is a little more than a lot. Okay, but what not at all is very minimal. Okay, these are only a few people, maybe like me, that are not influenced by work, that doesn't see work as demanding, or demanding too much of my time, or I'm passionate about my work. I like to do what I do, so there are just a few of them here, but majority felt that work has a negative effect on mental health. Now, 2018, before pandemic, even then, we already have stressed people, okay? People that are affected mentally. Graph 5 shows that when you are away from work, how often do you feel able to completely switch off from it? Okay, this is 2018. Okay, so during pandemic, this question becomes much more significant. Now in 2018, again, when asked whether you can switch off when you're off work, majority felt that they're not able to. This is not in Malaysia, this is worldwide. Okay, thousands of answers from the global. Okay, and then most people cannot switch off, unable to actually, let go of their work. Okay, only a few says always. And during the pandemic, this is a study the World Economic Forum reported, they run a quick survey on the switching off. It's called switching off. 40% of the respondents says they cannot switch off. Employers keep on texting and requesting them to do work. Now, during pandemic, we automatically resorted to WhatsApp, Telegram, emails, and so on. So because we are online. So the switching off condition becomes very obvious during this time, because you need to use the computer. You use the computer to connect to work. So therefore, you see, demand of work until nighttime. And in Paris, in France, they immediately pass a bill to actually penalize any employer that contacted the workers after 8 p.m. So the European country, developed country, are much more active and very, advanced in their activity. The moment they felt, it's not healthy, they immediately actually put in, intervene, and pass a bill. Pass a bill means there's a lot of enforcement and penalty that can be enforced via a bill. They can do that within the pandemic, within the first year during the pandemic. They're not even confining people at home. The European was, were wondering, were working, as normal as they can be. Even though the high rise of infection, they still do not actually confine you. There was no control movement, unlike in Malaysia. So the more you are confined to your houses, the more you can actually be asked to work, round the clock. And that's what happened in Malaysia. Everybody was talking about it, but we don't never pass any bill. So in Europe, in France, and in there's another country that is not very big, but I cannot remember which one, pass a bill. And that was taken as a precedent for the other multinationals to actually demanded that the employers be much more disciplined and not to contact their employee after 8. So even then, workers are like so connected to their work. Now, work from home have a negative effect to well-being. That will be my conclusion based on a number of findings that we find with regard to similar off-work kind of activities like telework, 27% saw telework as a constraint. Yeah, so if telework is seen as a constraint, work from home is not welcome by companies. 21% says that it's preventing family time because it actually encroaches into our family area and boundary. Last time you have a boundary. The moment you go out of the building, you're off. Okay, you can off your work. In Japan, they like commuting long distance. Why? Because the travel actually switch their brain into working mode, off work mode. Okay, so the commuting gets them into compartmentalizing their their everyday life. Work from home, 29% said they're too tired for household jobs at the end of the day. Okay, because they're in the house and they still seeing work even though they're at home. 72% are psychologically stressed, distressed. Okay. This was a KPMG run this survey globally, and you have to look at it. It's about level of burnout felt by employees, percentage of survey participants. Okay, 49% respondents say they are feeling at least somewhat burnout. Okay, 49%. This is over the different region. Okay, so the dark blue here represent to a very high degree, and this is high degree, and then it goes to a lighter blue, it becomes low degree of burnout. So always half considered somewhat burnout. The low degree is the next 50%. Which region has the highest burnout result based on this graph?
Australia?
Very good, Sagun. Sagun, is it? Bashira?
Yeah.
Sagun, suara lebih kurang ya. Bashira, Very good. Very good. Well done. Everybody, can you see that? Thumbs up if you understand how Bashira comes to that conclusion. Everybody can follow. Do you know how Bashira comes to that conclusion? Thumbs up if you understand. Tak ada thumbs up ni? No thumbs up? Azhar, are you sure, Azhar?
Prof.
Because you yourself have to do graph later. Sagun, Briar, are you with me?
Yes, Professor, it's clear.
Okay. Lian Hao? Are they still in? Lian Hao has dropped himself. Yizwan?
Yes, Professor, I understand.
Okay, because next you need to do your own graph. Okay, later. Right. So next, work from home have negative effect to well-being. These are just like examples of what can affect the well-being of a worker. Now, when you are not well, my argument is you can't perform. Now, do you understand have you heard the context of presentism? Have you ever come across the word presentism, the term presentism?
Absenteeism adalah Prof.
Okay, good. You're good, Sagun. Thank you. Yes, absenteeism normal. That's why I asked. Have you come across the word present, the term presentism?
Got, but not oftenly. Is
So
yeah,
do you know what is it?
yeah. Our present to work, whether we are like not feeling well or what, but that person will feel like, oh, I need to be present. Present is important for the work. Something like that.
Okay. Others? Okay, good try, Bashira. Presentism is you are physically there, but you're not mentally and present at the workplace. So even though you're not you well, but sometimes your mind is taken off somewhere else. So you come to work, okay, you are clocked in as attending, but you cannot function productively. Okay, you are distracted. Okay, or you're not well actually. You're not too well, but you still come to work because you refuse to take any leave. So you're counted as coming, you listen to meetings and so on, but actually you're not well and you cannot function. So that is presentism. We can see you physically, okay, but actually you're not contributing, okay, productively. Okay, so that's another problem with productivity. So in that instances, you're no good actually, because when you go to work, you need to be wholly there to be function. We know that to be effective, we need to be alert, because the brain needs to think for the company. Then the brain needs to produce solution, needs to be supporting each other, yeah, so that the others may not feel burdened by your lack of commitment to work. Okay, so that will actually put on stress on others. When company, recruit people, ideally, you recruit the number of people to actually fill up job responsibility. Job responsibility has been defined, and you know that you need this number of people and this kind of background to do the whole job, to come to arrive to a wholly concluding work results that could actually lifted up the company progress. But if you lack certain element, definitely it will affect, okay, the activity of the company. So that's why you need to be present. You cannot be presentism. Okay. Now this is another analysis on working hours. So more working hours doesn't mean you're good to the company. Okay. During the pandemic, this is a Malaysian study on the impact of working hours on quality of life. So with an increase of just 1 hour per day, more than 1 hour per day, the pink one, the darker pink means reduce a lot. Your quality of life is reduced. That means you're no good to other people. The more you're at work, 45% is reduced. Quality of life is reduced by 45%. Now let's devise at what point, which category of hours per day that will give the most quality of life. My question, at what hour of a day as categorize here where your quality of life will be optimized.
The fourth one maybe increase by less than 1 hour per day.
Okay, Bashira says this one. Okay.
Improve a lot.
What about the others?
Yes, the fourth one because of 40%.
40%? Okay.
Reductions.
The ladies win the game, is it? Yes, the answer is increased by less than 1 hour per day. Okay. You'll get optimization of your quality of life. When you're happy, the other aspect of your life will be happy. Happy workers, happy, more productive. Okay, that's the relationship. I wanted to say something. Okay, a long time ago, okay, there were a study that looks at how much reward increase in how much reward should we give to just good enough to encourage and motivate people to contribute. So there was a study how much value of a money as a reward needs to be given to actually encourage motivate people to contribute. Was it $150, $100, $200? So when they did a study, they discovered just $100 actually would motivate people highest level. More than $100, even if you give them $200, it will not increase anymore the motivation. So the moment you understand that, it will be cost effective on your side, isn't it? You don't need to give 250, 500 just to motivate somebody. Giving them 100 ringgit is just enough to push them to optimize, to produce the highest contribution that they could possibly give. Okay, so that's good knowledge for companies. Okay, now let's look at work hours. Okay, we talk about shift work. Okay, this is specifically or normally something that is related to occupational safety and health. So occupational safety and health always like to look at the issue of shift work and so on. Now, I think this study is in America, but this is no different from what we experience here in Malaysia. If you're working in a manufacturing firm, 12 hours a day is normal production time. Okay, for even our workers, because most of our factory are American factory. So it follows the factory. Now in 12 hours, okay, working condition, this represent the y-axis represent mean relative risk. So this is the dark bar chart, the black bar chart represent risk. And this is hours of the shift, the first hour to the 12 hours. Okay, so at 12 hours, the risk becomes double. But the risk went down significantly, okay, reduced by 2 times at the 6 hours, 7 hours, okay, 6, 7, 8, and then it pick ups again, yeah, consecutively. So normally, this reduction in hours of shift is due to rest break. You get a rest break, then when you come back, yeah, the attention becomes higher again. When you are attentive, your risk will be lower. Okay? This is the kind of analysis I'm expecting from your project work. Okay, from the data that you're given, you need to actually um, be able to actually do this analysis. So long hours impacts health. Okay. So long hours actually give rise to more cardiovascular disease. Okay. And will die earlier, death. Okay. This is very obvious. This is a accepted study, but yet people still um, work longer hours. I work longer hours, I think. But if I can sleep, I will sleep. Okay, more. But I do not know whether it will shorten my life. Okay, but it's something that I decided to do. I choose to do. Okay, but this is the results. Okay, so I hope that I like my job so much that I won't fall into this group. Okay, right. This is another observation that I can share with you. I put this in my slide, and the references are also in the slide. Yeah, this is quite a recent study, 2021. So you work longer hours, it will actually increases your cardiovascular disease. Okay. This is in from 20 I think 2019. It's still the same. Okay, but they don't issue this kind of graph anymore in Malaysia. So for those in Malaysia that ages 41 to 59 years, you are 20% of you um, will die due to heart disease. Okay, those who are younger, the biggest cause of death in that age group, is actually via transport accident, road accident. Okay, this is definitely not good for the country. But my question to you is why? Why is it not favorable to a country? If this is the statistic, I know it's not favorable to the country, but why? I want to know your assessment.
Professor, because the dynamic of changing is the people from 50 to 40, if they go, so the future of the country will be under risk. They are the most productive in the society. This age.
Thank
50 to
you.
40.
You said all. Thank you. Very good, Brian. Exactly. 15 to 40. How old are you, Brian?
I am 26.
20?
26 years old.
Okay. So you're too young. But people in the age of 32, 34, if you married, how old will be your children normally? From your observation. People in
Primary
the age
school?
of again?
Primary school, maybe?
Yes. The eldest, right?
Yes.
And those are the years, as Brian has mentioned, is the most productive years, not just in terms of work, but also in family life. You're small children. So if you die, okay, even though both of you are breadwinners, okay, both of you are working, but the loss of one breadwinner and the children are growing up, it will cause a social problem to the country. And this is what Malaysia is facing.
Professor, also Canada has the same problem, labor shortages, because their population Canada is the second largest country about the size, and the population is not that high. It's 39 million. So now they are suffering from the same problem. The native people are old, so they ask the migrants to come, especially the young age, because most of the people are old in there. So this face the labor shortage as well.
So Canada has, okay, just for general knowledge.
Yes.
Thank you, Raya, for bringing up Canada. So the population only 39%. You know how large is Canada, right?
It's second largest
Everybody?
after Russia.
So why is the population only 39%?
Because it's inhabited. It's freezing country. It's too cold.
Thank you, Brian. So because it's not just that it's inhabitant because of the the weather. Yeah. So most of the parts of the country are not highly populated. Yeah. So the population are concentrated on certain portion of the country. Yeah, nearer to America. So that's why the head count is small, despite of the size of the country. So you're saying, okay, so this is, so if Canada is a disadvantage because of the aging society and low birth rate, in Malaysia, the causes of our loss of the young is due to transport accident. And this will actually becomes a social problem in the future. You don't have productive labor, and then you have a lot of injuries. Remember the employment injury and so on. So, but you need to travel to work. In Malaysia, you need to travel. People live long distance. People don't use public transport. Yeah. So this is a social ill and a social problem. So work are also affected because you don't get good talents. I've been monitoring road accident in a number of industry, and sometimes we have fatality, and I would be told of the occupation of these people and what do they do at work, and I feel so disappointed because of the they are trained people, they are talented people, they're just not I wanted you to also acknowledge even the cleaners. Can you imagine going to hospitals where the toilets are not maintained by the cleaners? Can you imagine that? Going to public places, you go to petrol station, you go to our highway rest areas, and there's no cleaners, servicing the toilets. Can you imagine using the toilets in that condition? So all work are important. They matters to our well-being on day-to-day basis. All right. So finally, work from home, for instance, okay, if we're talking about work from home, we can also talk about work. Work from home impacts safety. So this is another element. Just now, we talk about health and how it affects work. Now, I talk about how work, we also talk about how work scheduling affect family well-being, and that will be translated into the world development and progress. Now I talk about work from home and how it impacts safety. Okay. So it seems that during work from home, during the pandemic, they observe that there's an increase in workplace harassment. So I hope you know what is workplace harassment. If you're not aware, then we can discuss about that sometime in the class. Workplace harassment increased during the pandemic. How? Because of the usage of a lot of internet. One, there was a lot of hostility between age group. Usually the older group has some difficulty managing the technology during that time because we are suddenly like enforced. I came across that as well. I had to do training with a group of professionals. but there are different age group in the group. And I can sense, because of misunderstanding, because they're not aware of how certain software and apps were used. So they refuse to do things that I ask you to do, with the implying that they would have to actually forego their computer memory or phone memory, that they have to download the apps, which they don't. They're supposed to just use the web base. But because of their, I'm very well informed of that. So I don't jump. I don't feel threatened by the refusal. So we address it, but not everybody is understandable or understood the challenges of the different age group, because I do a lot of training in campus. So I kind of be aware and exposed to these differences and problems. So when I train the industry, I can relate and I know how to manage. Now, during the work from home, there's a lot of use of technology. So there's an increase of harassment towards different age group, especially the older. The older felt that they are abused. They are disregarded. They are being left out. Yeah, they do. And sometimes remark from the young, Allah, can't you make sense? Don't you see, people laugh, 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 laugh. That is actually, to some people, it is a intimidation. Intimidation is a workplace harassment. Okay, right? You have work. Intimidation is a form of workplace harassment. When you laugh at others because of their incompetency, you are intimidating. Now, 25% also felt harassment because a lot of these online sessions are sometimes one-to-one. On the phone, a lot of on the phone conversation. So there was a lot of inappropriate discussion happening on the phone, which may not be agreeable to the other party. All right. So in other words, that involves safety, isn't it? Harassment is safety of the workers. So work from home doesn't just impact the health and the well-being of the people, but it also impacts the safety at work for the people. So in this study, 25% of the respondent says that. Now, so this was some of the causes of this harassment. Okay, bloodlines. So you get, male manager or lady manager calling, a different gender at night, trying to, discuss about work and so on. And you are technology dependent. So the informal part there's a lot of informal arrangement. Okay, so finally, work from home, this kind of work leads to low employment security. This is also a form of safety. Okay, safety and health practices. So the safety part, and then there's the health part, okay, practices. So it's also provide low employment security. Okay, because, hold on. Okay, there are very unclear demarcation of job losses. Okay, people work with poor work condition. Okay, what will, looking at these photos, this one I took from the papers displaying, and I actually have photos, but I cannot use it because but I have images, when I was doing training for one big multinational corporation. They were so anxious, because we were doing trading under the company. This is a big company, and because in Penang, we live in small quarters, right? Most of us live in apartment, flats, with fewer workspace. Yeah, our houses are small. We don't normally have a landed property. Most of us don't. Okay, we don't have that in Penang, most of us. So during the pandemic, people had to work, at a common area, okay, in the kitchen. So during the training, they were working in the kitchen. So they may not be comfortable, showing the background of their houses and so on. Okay, and then their children will come, run. So I was comforting the whole training that it is okay to allow, the children to just pass by, so they shouldn't feel intimidated, or they shouldn't feel insecure by the view that we may see. So that is training by me. But how about when you have meeting with your bosses? So this can create stress among workers. Okay, like this lady here, what health issue she would actually um, would resulted to her? Can anyone help me? What kind of problem she may be experiencing after how many months we were in control movement order? What, 8 months, 9 months? What kind of problem she would be facing? Can you identify one or two for me? Again?
Stress, Prof.
Stress. What else?
Maybe she sitting position.
Look at the image. Focus on the image. Stress is one. What else? What could possibly affect her?
Professor, it impacts her family because the woman normally take care of their family, their husband, their children. I see the guy that watching TV, something like that.
Okay. Yeah,
He looks,
maybe this is a night time because it is, what the guy is already at home and then watching television, isn't it? Okay, maybe. What else?
maybe she's sitting position is not benefited
Very
for her
good,
body.
Izwan. Very
Yes,
good,
thank you.
Izwan.
Thank you, Professor.
Exactly. Her sitting position is damaging her
Yeah.
back.
Yeah.
But stress is also good. Stress is possible. When you are like working like that, and then your husband is watching television with the noises, right? And then like the husband is not, maybe she's in a meeting, this is a daytime, because it's a lockdown, so everybody is at home. But maybe the husband has no work, no admin work. But she is a secretary or a clerk that needs to do work, and she may be, needing to have a meeting, and the husband is not, cannot come because he has the television. Why shouldn't he watch the television? So eventually she gets stressed. But her sitting position now, we know as safety experts, she will actually succumb to back pain. Okay, back pain. This is not a good posture, sitting for long period of time. What else? Her, her angle of hand, typing. Okay, this is good for watching television, watching a movie via the laptop, but not working on a laptop. A lot of other health problem can come down to this.
also, Professor, I think it leads to have a sedentary lifestyle. Sedentary lifestyle. Those people that they just sit, it leads them
Yes,
to obese, to be obese.
correct.
But there's no
Do you
physical
know?
activity.
Exactly, correct. Sedentary sitting is no good. Prolonged standing, also no good. So
Yeah,
we need to have a
you have to
combination
walk
of
the
both.
line. You have to walk the line.
Exactly. Yeah. So okay. Can you name one or two health problem that can be resulted out of sedentary sitting position? Let's see whether, sitting. What kind of health problem?
Obesity first.
Again?
obesity, being obese, overweight.
Yeah, obesity,
Yes, and back pain.
With this,
slip disc, back pain, correct. What else?
And for general heart health, for your heart health condition is not good because the general practitioners suggest for us to run or walk or jog, something like that. For those people that
Exactly.
the rate, maybe they have a heart stroke, the rate is higher than the possible, is more possible to face a heart stroke or heart attack. Those people, they have a
Yes.
sedentary lifestyle. And above
Yes.
all, Professor, diabetes.
Yeah. Obesity will lead to diabetes
And
in
cancer as well.
inactive. What else? Azza, are you around? Can you hear us?
Yes, Professor.
Are you
For eye
okay?
disease, okay, Professor. For eye
Again,
disease,
Azza?
because eye disease because much focus in the screen.
Again, I didn't get you.
Eye disease
I
because
Oh,
eye
eye.
disease
Yes, yes, yes. Because
because
of screen
yes,
view,
yes,
correct?
Professor.
You're right. Good. What
Hello,
else?
Professor.
Hello.
Maybe cervical, his neck, neck.
Okay. Neck problem. Good.
Yeah, neck.
What else?
And reduced
Uh,
lifespan, Professor. Those people.
Yes,
Big
as
time.
we have seen, right?
Exactly, reduced lifespan.
Okay. So I would like to contribute. One would be constipation. You know what is constipation?
Yes, it's hard to,
yeah.
with all due respect for all of them, it's hard to go to toilet, something like that. Those.
Yes.
Yes.
Constipation. Please remember, prolonged sitting leads to constipation. Okay. Other than slip disc, back pain, very obvious. Yeah. It's also a constipation. This is what we are seeing because I'm involved in a study with my colleagues in the UK, and also I'm also studying here in the pots. We look at those who works in the pots, okay, but have to sit for more than 8 hours a day. They're supposed to actually come down and stretch, okay, after 4 hours, and then only go up for another 4 hours. But they
yeah.
refuse to do that in Malaysia because they they want to go back early, okay, and they don't want to have to come down because like if they are a key crane, you can Google what is a key crane. So if they're a key crane driver, they don't want to actually have to come down and then go up again because it's quite, a hassle to come down. But for health reason, they're supposed to. But because they don't have knowledge, like you guys, okay, for me to tell you and nobody tell them, I think even the safety and health officer are not in Malaysia, are not aware of this problem.
Yeah.
So lots of, a lot of people who have to sit long hours, as the key crane operators, they have a lot of constipation problem. Constipation can be very severe, okay, severe health problem, okay, to the extent that some of them will need to be operated. Some of them would not be able to sit at all, okay, until certain age, yeah, because sitting becomes too unbearable, okay. So even though I do not know whether you have experience with constipation, but constipation actually reduce quality of life. All right. So it's not easy to manage constipation. So this is something that I want to impart for you today. So I hope, okay, this is the concept, okay, that I will actually bring, okay, for the weeks to come for our course here. All right. I'm not going to talk on the technical side of safety and health because that's not the objective of the course. We want to, for people that are not technically equipped with safety and health to understand. It is an awareness course, on what is safety and health, and why it should matters to all walks of life and all level of people in an organization. Okay, so you can understand the consequences to, you can appreciate the consequences to people's life. And your action at workplace doesn't end at workplace. It's actually related to other things in other people's life. And at the end of the day, it will affect the country, progress and so on. All right. So that will be all for me tonight. To end the session, I would like you to post in the chat box. We're not that many, so you can just post in the text box. Maybe at least one new thing that you have learned from my session today. Put down, okay? Let me know of one new thing that you have learned from my session today. Okay. And thank you so much. Do you have any question? Okay. So thank you so much. I would like to say thank you to everybody for being so active and participative. Yeah, because that's very important for me to actually make sure that you understand what I am conveying. That's my checking mechanism, to make sure that it's not to check you, but to make sure that nobody is left behind in the discussion. All right. Online is sometimes, I do not know whether you are connected to me. So I want to make sure that, if you have issues, connectivity and so on, you're not left in the discussion. Now, and Yizhuan, thank you so much for making the effort to make sure that your site is connected, okay? Well, with the classes, okay, after the first class. So thank you so much for making that effort. All right, I appreciate it very much. Okay.
Thank you,
And
Professor.
and nice to have you with us. You
Thank
are
you
still
so
in
much,
China,
Prof.
right?
We learn a lot
You are
today.
still in
Yeah,
China. Okay.
yeah.
So, okay, hope to see you all guys after Raya. Okay, so next week is Raya. Happy Happy Hari Raya. Okay, Yizwan. Okay, if I still have my
Yeah.
cookies, then I'll bring some.
Yeah, okay.
Okay, in the next class.
Okay.
See
Thank
you.
you, Professor.
I'll see you
See
on the
you.
19th. All right, on the 19th.
Yeah.
Okay, so
Have a
have
nice
a
day.
good rest, everybody.
Have a good night.
Okay, I will. I need you to do something actually. Okay, let's stop here and as your tutorial, I need you to do this exercise because don't do everything, okay? I need you to do 21C. Okay, 21C.
Okay.
Okay, please attempt 21C, and I haven't seen you introducing yourself. Where is it? In the self-introductory. You haven't done this. Nobody have done it. Okay, 1.1.
Comment in the box, yes.
Yeah, please do this, and also 2.1C. All right? Okay, that will be all from me. Thank you so much. Have a good, yeah.
2.1C, that one is for conventional students, is it?
2.1C, this one. This one. Hazard, risk, and safety.
It's in the ODL also?
Are you in ODL?
Yes, Prof.
Okay, so you will do in your ODL. Okay, ODL. I don't think I posted ODL. ODL, you should be following ODL. Okay, ODL have different, not different, but a number of activity because of its ODL. You're not supposed to be able to listen to this online. So please attempt the ODL, okay? If you're in ODL, please attempt the one in order. I don't mind you here, but please attempt because ODL have different pace and different, but eventually you will be doing the same thing. However, because of ODL, I need to, do a different approach, okay? The content is the same. Okay, Sagun?
Okay, I understand,
What I
Prof.
asked
But I
2.1C,
just
yes,
listen
eventually you will do it in your ODL, but not this way, okay? Because I need to get you move in a different pace, okay?
All right.
Sorry, Sagun. I don't register everybody yet, okay?
Okay, Prof.
But thank you for attending. I don't mind you attending, but you don't have to, all right? Okay, so this is for non-ODL.
I follow the activities there, but I joined the class. Can I?
Yes, yes, correct.
Okay.
Okay, fine with me. Okay, for those who are non-ODL, you have to do 2.1C by next week to be submit. So please observe the deadline, all right? And please do your self-introductory here, which has not been done. Okay, nobody had done it. I do not know why, but please do this and upload it. Okay, so thank you so much. Have a good rest, good evening, and stay safe. Happy Hari Raya, and see you after Hari Raya. All right, thank you.
Thank you.
Okay. Thank you.
Assalamualaikum.
Thank you. Bye bye.
Enjoy your leave. I'm taking a week leave. Okay.